Hi, everyone. It's Dr. Emily back from Wildcraft Medicine, here to do another Facebook Live interview. Really excited to have Amanda Dahl joining us today. She is a Reiki master and teacher, health coach, soul coach, I love that term, and co-owner of Dahl Holistic Health here in San Diego. I have worked with her personally, and I have lots of my patients work with her and just noticed such a huge improvement in their health when we tag team and help them on all aspects of their health. So really excited to have her. Amanda, thank you so much for being here.
Thank you for having me.
Yeah. So I guess kind of first things first, let's kind of dive in and talk a little bit about the modalities you offer. I know a lot of people have heard the term Reiki and may be familiar with it, but they may not know kind of the ins and outs. So do you want to give us a little background about what Reiki is?
Sure. Reiki is a Japanese healing and relaxation technique where the practitioner puts their hands or energy senses, because we can do it from a distance, on the different chakras of the body, the meridian system of the body, and the aura system of the body, which are the three main energy systems in everybody's body. And what we do is we're looking for energy disturbances, which could be blockages. It could be areas where maybe you're depleted. And we just either take some of that excess energy away or remove those blockages and replace that energy with fresh new energy so a person feels more rejuvenated after.
So thank you. That's awesome. To kind of dive a little bit more into what people may experience, first off, how would someone know that they may have an energy blockage? That may be a first good place to start.
Sure. Well, when we're working with people, especially the clients that you and I tend to see together, one of the things that happens is maybe they're doing all of their physical treatments, right? They're taking medications, they're running, they're eating healthy, but something still feels off and their health is plateaued. They can't get past that barrier of whatever's holding them back from really surging forward. Usually that's an indication that something energetically is going on inside of their body. So for example, a lot of times we see when people have a lot of gut dysbiosis, a lot of times there's something going on with the way that they feel about themselves. There's been an event that's happened that's affected their self-esteem. And this could be something that goes all the way back to childhood. I mean, we've seen clients that have had traumas happen when they're 2 and 3 years old. And when we start removing some of those energy blockages and just chipping away at that, whatever that is that's blocking the energy from being able to move through, it's enough to help that person work through whatever that trauma is, remove it, and then all of a sudden, their gut biome is feeling better, their medications are working better, they're feeling more confident. So that would just be one example of something that we see with energy work, and being able to know within ourselves if there's some kind of blockage going on. But if maybe somebody's always clearing their throat, they speak really softly, they have a lot of aches in their throat, that might be something's affecting their ability to speak out, to speak up for themselves. We see that a lot in trauma. Headaches, when things are going on in the head, or racing thoughts, sometimes we can't calm our thoughts down. That's a pretty good indication that there's something going on, and a person would need some energy work to just kind of smooth out that energy that's just kind of.
And these are such good examples because, so often, as a doctor, and I'm sure a lot of patients out there experience this, that there's just something that's preventing them from getting to the next level. And so I love hearing your take on it, because it really explains just how intricate and important this energetic aspect of our health is. I mean, I know
Absolutely.
A lot of people kind of think it's a little wooey and out there, and is it really doing anything? But if you really think about it, energetic health and our energetic being is really at the absolute root of most of our mental, emotional, physical ailments. And so, if you really want to get to root cause, this is why I work so closely with Amanda with a lot of my patients. It's getting to those energy blocks or excess or deficiencies that can just really turn things around. Make people
Absolutely.
feel so much better, right?
Absolutely.
Yeah.
And sometimes I'm able to detect maybe there is something physical going on
Mm-hmm.
with somebody. And, I've had times where I've said, I think that you should go and talk to a doctor, because maybe I'm seeing something energetically, like maybe there's energy that it is just not moving.
Mm-hmm.
I've been able to help a couple of people that had some blockages in their bowels, and they came in and they were working on things energetically. And I said, you know what? This is something we're not able to move this energy at all. So that tells me this is something that you need to mention to your doctor.
Right.
So it goes both ways for sure. If
Yes.
I see something going on that I think,
Mm-hmm.
there's been times where I've referred people to right back at you,
Right.
that something is going on. But these things work so hand in hand,
Mm-hmm.
that it's a great partnership to have for people when they're putting together their team of
Yes.
people that are going to help them to heal.
Absolutely. Right. Because you brought up constipation, and this is such a common symptom that people come to me with, especially with digestive issues. And
Mhm.
on the energetic side, it's like, what are you not able to let go of? Right.
Absolutely.
And especially if there's trauma involved and, other kind of emotional things that have been going on, this is such a key piece. Like, we could give you ginger and all the, they called prokinetics, like help, the muscles of your gut move better, which definitely can be helpful, in magnesium and vitamin C. But if that energy blockage isn't moved, then those things aren't going to work as well as they could if the energy isn't, is taken care of. So
For sure. And it is worth noting too that, a lot of these traumas are things that people don't want to talk about.
sure.
I have people that they've been going to a talk therapist for years. And I have a couple of therapists that actually refer people to me now, because I tell people, when you come for energy work, a lot of times it's that talk therapy without having to talk. You don't
Mm,
have to tell me the traumas. I am just there to facilitate moving that energy. You can lay there, on the table, or if we're doing a distance session, because I work with people, distance right now,
mhm.
that person can just lay there and just relax and just let that energy be removed. So it's a little bit of a loophole for the people that are having a really hard time saying these traumas, because it's scary. It's
It is
scary
scary.
to say these things. They don't have to. We can just remove some of that energy. And I have clients that, sometimes they cry, you know,
Mhm.
and that's perfectly okay. If they want to share and talk it out, that is part of like my soul coaching role, is to be able to help people to move through some of these emotions. But
Mhm.
it's not something that people have to say to me. You don't have to know what's going on. Sometimes
Mhm.
people don't even know what these
Right.
traumas are that
Mhm.
they're holding in their body, and that's perfectly okay. The end goal is that you feel better, you're able to move through the trauma, through the things that are going on, so that you can get to a place of health.
Awesome. Love that. And it's such a good point. Like, when people do work through their traumas, and if they're having to talk about it, it brings it up again, having to relive it. And that can be really difficult for people. So it is
Absolutely.
nice to have that safe space to be able to just let your body process it as it needs to. I always tell my patients, energy work is like, um, the energy can kind of get stuck and stagnant and build up in the body, and it's kind of like taking out the trash. If you never take out the trash, the trash is going to build up, and start to overflow into other areas. And the same thing with energy. If you're
Absolutely.
not constantly kind of working on it and making sure that it's in the right balance, it starts to overflow and then can start to affect the mental, emotional, and even physical aspects. So cool
For
what you
sure.
do. Now,
Yeah,
what do patients experience typically when you're doing the therapy on them?
sure. Most of the time, patients will feel some warmth, maybe a little bit of tingling. Sometimes there can be a little bit of emotion that bubbles up. And I tell people, if you feel like you need to cry, cry,
Mm-hmm.
right? Because this is the time to not hold it in anymore. This is the time to let it move through you, right? Because when negative things happen to us in our lives, a lot of times we clench up, right?
Mm-hmm.
We hold on to that. And we're like, well, I can't even think about that right now. I can't process this right now. So when we're doing this energy work and we're actually starting to nudge some of that energy so that it can finally move through you, that's the time to let it go. That's the time to have those tears, have that emotion, because I guarantee you that at the end of it all, you're going to be so glad that you did, because then you're going to feel how open you are. Maybe you're walking more upright. You know, maybe you're finally moving your bowels, right? I mean, I know Emily's working with people all the time that can't move their bowels. Let's, like she said, let's take out that trash. Because sometimes you'll feel that during a session. A lot of times people, their stomachs will start to growl because we're moving that energy. But overall, the number one thing I think people feel in the end is relaxation and some peace, because they're finally getting a chance to just lay there, let that energy move through them, especially if there's been blockages. When I work with a client, I do energy sensing to see where the blockages are. I don't stop working on them in that session until that blockage has moved, so that I can feel the energy going all the way through the body. If there are still places that energy is getting stuck, I keep on working, because in the end, I want you to walk away and at least have that moment of feeling really good. Even if you decide that you're going to kind of clench up again and, you know, that energy builds back up and we need to move it again in the future, that's okay. I want you to feel that it is possible to feel good again, because sometimes we forget that when we're not feeling well.
Absolutely. And from personal experience, because I go to Amanda myself, you know, especially in moments where like high stress and trying to run a business, work on it and in it. And, you know, so many aspects of life just get overwhelming. You know, and when that happens for me, I just feel completely unproductive. I feel ungrounded. So after my sessions with you, I feel just totally relaxed. That's very true. That's probably the most common thing that I'll feel after every session. And I just feel this sense of feeling very light, that things have been unloaded out of my brain. I don't feel as scrambled and all over the place. So it really makes such a difference. And then I notice like my mood all of a sudden is a lot more uplifted. So it allows me to feel more productive and get things done. So yeah, it's been amazing working with you, Amanda.
Yeah, right back at you.
Real deal.
Yeah.
So, you know, and I mentioned too, Reiki master and Reiki teacher. You know, I think there's a lot of people out there that are doing energy work, which is great, but there are, like anything else, different degrees and different levels of, you know, how certified someone is. Do you want to tell us a little bit about like the master part of your title and some of the teaching that you guys do?
Yeah. So both my husband and myself, we went all the way with our Reiki studies. We are Reiki master teacher practitioners. So we've gone all the way. We've done all of the levels. And what that training involves is, you know, working with a Reiki master who, you know, nurtures. They really nurture. It's not just, well, this is important to me. You take a class and you should have like some mentorship. So, and that's something that we've carried through in our program. You know, we mentor people that want to work with us. Level 1 is learning Reiki to heal yourself and to work on healing yourself. And a lot of times when I'm working with clients doing sessions, we'll get to a point where, you know, they start to get curious, like, geez, this is really helping. How does it work? And we start having those conversations. And that's when I recommend to them, take the level 1 class, because then you can use those tools, same tools that I'm using in a session, you can use those tools on yourself to keep that energy flowing on a daily basis. A level 2 class involves learning how to do Reiki on other people, but also learning how to do distance Reiki, which has been extremely helpful during these times, because, you know, I'm doing Reiki with people every day. You know, and you can also, you know, you can send Reiki to situations, like just, you know, everything that's going on in general. Like, you know, I'm sending Reiki to hospitals, I'm sending Reiki to the earth, you know, anything that you want to shift that vibration, shift that energy, you can send Reiki to it. And then going Reiki master is really, that's just making the commitment to, I mean, I'm constantly thinking about how can I use Reiki to improve a situation. And Reiki just means universal life force energy. right? So we're just using that energy. How can we move that energy and shift it to a higher vibration, to a higher frequency, so that we can improve the good of the earth or our client or a situation that we're in? So Reiki Master is just using that energy to improve things all of the time, as well as learning to teach. Not all programs take their students through being a teacher. A lot of programs will take you through being a Reiki Master practitioner.
Mm-hmm.
Our program takes you through being a Reiki Master practitioner teacher, which is,
Oh,
there's a
awesome.
pretty big distinction.
Yeah, that's amazing. Yeah, so it sounds like it's, a lot of training and hours and experience. It's pretty amazing.
It
And
is.
you mentioned distance. So,
Mhm.
I know obviously energy, everything is made up of energy and all that. So I guess that, that makes sense in my mind. But can you tell us a little bit more about how distance Reiki works and,
Sure.
how you kind of do a session with someone when it's
Sure.
distant?
So when we're doing distance Reiki, this is the easiest analogy I've been able to find. So if you listen to the radio, you're tuning in on your radio to a channel with the intention of listening to the music that comes through.
Mm-hmm.
So what we're doing when we do a distance session is we're like the radio station itself. So we're putting out a particular vibration, a particular frequency, and we're intending it to go straight to the client that we're working on. The client knows that we're going to do the session, because we never do distance Reiki without touching base with that client that has
Mm-hmm.
booked the appointment, talking to them about what the intention is for the session. And we always ask permission to start. That's a very important piece to this, is to make sure to have permission. So then you're laying there and it's like, okay, I've turned on my radio and I've turned on that, to that radio station. And then I'm going to start transmitting the music that you want to listen to. So that's like
Oh,
been
cool.
the easiest way that I can explain how it works. From a scientific standpoint, we are working with quantum energy. So if you remember your science class from when you were a kid, you learn, about an atom, and it has protons, neutrons, electrons, it's got the nucleus. And there's all that space in between all of those different components. That's called dark matter,
Mm-hmm.
or quantum. That's the quantum energy. We can't see it with the eye, but we can quantify it when it's all together, right? We're moving energy towards somebody else through that quantum energy field. So that's, from more of a scientific standpoint, how we're moving that energy. It's all
So neat.
intention and channeling through that frequency.
Awesome. And how do you know as a practitioner that you are achieving that goal? I mean, is it mostly just how the patients are feeling afterwards?
Actually, no. I don't base knowing that the energy goes through by how the person feels after. I'm very good about I stay detached from my ego in the
Mm-hmm.
process. My goal is to tap into their energy field, and I can feel it. And it's just something through training and working with people so much. I've always had the gift from when I first started, being able to feel that I've tapped their energy field. And then what I work to do is I keep my ego out of it. I'm not using my own energy when I'm doing energy work on somebody else. I'm using that quantum energy that we just talked about.
Mm-hmm.
That's energy that's accessible to everybody. So I use that energy to, do the work that I'm doing. And most of the time, most people feel it. It's very rare that I have somebody that says, I didn't feel anything. But even if somebody doesn't feel anything when they've had a session, the energy still works. It
Mm-hmm.
just depends on, sometimes somebody might be really nervous. So maybe they're not letting that energy really flow in. Maybe they're only letting it go through their aura, which is on the outside of the body, versus really flowing through the inside of the body.
Mm-hmm.
So I know that I'm tapping in because I can feel their energy field. That's how I know that I'm there.
Awesome. So, who would you say is Reiki is for, or like what types of clients do you work a lot with? Any
Sure.
in particular?
Just like for anything, right? There's so many different types of styles of energy work. And for me, I like to work with the people that they've been going through stuff for a long time. Maybe they've been sick for a long time, or they've been feeling lousy for a long time and they haven't been able to get the answer, or they've gone through something that no matter what they've done, they haven't been able to see a good result. I
Mm-hmm.
like to work with those people because, just to share a little bit of my own story, when I came to Reiki, I had been sick with Lyme disease for 18 years. It took 18 years for a doctor to diagnose me. And once I was finally diagnosed, I started working with different energy practitioners. I ended up working with naturopaths, and that was wonderful because I was able to get the tools that I needed from the medical side, the different medicines that I needed to heal. But there were a lot of energetic things going on. And when I came to Reiki, it was because somebody had given me a massage who was a Reiki practitioner. And I could feel the energy flowing through me from the very first time that she did it. And I said to her at the end of the session, "What's going on?" Because I've had massage and that was not your average massage, because I was feeling that energy. I was seeing color, and now I understand all those things, like I'm an energy sensitive person, but that's how I came to Reiki. And then it got to the point where I wasn't booking the massage with her anymore. I was booking Reiki sessions with her because it helped me so much
Wow.
with my healing. And then, Emily knows, because I was working through her practice, when I started to feel better, it really amplified once I was having that energy work done. Then all of a sudden, all of the tools that my naturopaths were giving me were working so much better. So I like to work with the people that, they understand that they need this piece of it in their healing. I don't tend to work with clients who just want to relax. I really tend to work with people that have a lot going on and need somebody that understands that path to get to where they need to be.
The complexity, right? I mean,
Absolutely.
all those different layers, and understanding that common thread for a lot of those different complexities is that energy blockage or support that they need. So
Absolutely.
awesome.
Yes.
And again, I've seen, with my own eyes, working with patients, and we've hit a block, and we've tried a lot of things and it's working kind of maybe just status quo, and sending them to Amanda, and all of a sudden things are just clicking into place. So
right,
it's a pretty awesome tool.
yeah.
Awesome. Cool. So I want to transition into well, let's maybe talk a little bit about one of the other therapies first that you do that's really interesting, biomagnetic therapy.
Yes.
And yeah, do you want to just kind of tell us a little bit about what biomagnetic therapy is and how it helps your
Sure.
patients?
Sure. So biomagnetic therapy is another energy healing therapy that we do. And I started using it again when I was sick with Lyme. I used it along with Reiki, and it was really helpful. So biomagnetic therapy is using magnets. And let me just give you an idea of what these magnets look like. So these are what the magnets look like. They have a positive side and a negative side. Okay. So what I do with the magnets is, again, we're working with those energy systems of the body. So the magnets work primarily with the meridian system of the body. So your chakras are where you have a gland and usually organ systems that work together in one area. The meridians kind of come off of those chakra systems and get down into the ends of our fingers, the tips of our toes, the areas that aren't next to the huge energy center of the chakra. So what I do is I use energy sensing or kinesiology muscle testing, just depending, are we doing it in person or are we doing it distance, because I'm able to do magnets from a distance as well. And we're using energy sensing to see, is there a disturbance in a particular meridian of the body? And what happens is our bodies will become either too acidic or too alkaline, and you'll get disturbances in the meridians. What those disturbances are is their bacteria, fungus, virus, parasites, or inflammation. And they'll actually block a meridian. So for you as a patient, you would be feeling like, maybe you've got a parasite infection that you know about, but it won't go away.
Mm-hmm.
So when we detect these disturbances, we put a magnet on each end of the meridian, and what those magnets do is they talk to each other, and they neutralize the pH in between the two magnets. So if there's, say, a virus in between, it will neutralize it and kill it off in that meridian. And then, you might have, for any of you familiar with a Herxheimer reaction, you might have a little bit of a Herxheimer reaction, or a die-off reaction is what some people call it. But, you might feel like you've got a slight flu for a day or two after, because we've actually killed that off. So then your body will excrete it either through bowel movement or urine or sweating. Sometimes people sweat a lot to get it out of their system. But then it brings the pH back to balance so that you're not too acidic and you're not too alkaline. So when I'm doing this, I actually do energy sensing or muscle testing for over 350 different points in the body. Which are, all those points are associated with either an emotion or a condition in the body. And then we dissolve it. The thing with the magnets is that usually it's not a one and done thing. Usually it takes at least a few sessions to really get through the body and find, all those disturbances that are going on. So usually in the beginning, I'll tell people you'll come every week to 2 weeks, just depending on how you handle it. And in the end, most people are coming maybe once every few months, just to kind of get we do a full scan, and they can just see like what might be brewing to see what's going on.
Wow. That sounds like an amazing therapy, not only for kind of treating any issues that may be lingering, but also kind of like as a diagnostic, right? Like really assessing the body and seeing where and what may be causing an imbalance. So
yes, the thing that's tricky about the magnets is that because I'm not a physician, and most magnet practitioners are not physicians, we have to be very careful. We can't say, oh, you have HPV, or or that big virus that's going around. Like, we can't diagnose that with the magnets. But what we can tell people is you have a virus, or you have a bacteria that's growing. And a lot of times the information that we have from the person who originally started this therapy, it doesn't tell us beyond the word virus or bacteria. And honestly, it doesn't even matter, because we're putting those magnets on, and we're neutralizing it and getting it out of there. So it's a really helpful therapy that way. And it's very helpful for pain too. We have a lot of people that we just work with that have pain. We can put the magnets on those different pain points. Oops, sorry. Sorry. We can put the magnets on those different pain points and actually help to draw off some of that inflammation that builds up in an area too.
Which is, really helpful for these patients, chronic patients or what have you, that, we're trying to work through things. Sometimes it's just the inflammation or the immune dysfunction that prevents us from being able to move forward, right? So having a tool to kind of help neutralize that, that's not just you can take supplements and, turmeric and ginger and all these natural anti-inflammatories that are great, but, I try my hardest to not overwhelm people with a bunch of supplements. So if there's another tool to be able to do that without having to take another pill, it's, that's really, really helpful.
One of the most helpful things for patients, if they're working with me and we're doing magnets, is to have a good detox protocol. Because if we're killing things off, and if we kill off a lot, that will float around the body a little bit. And then if we don't have a good way to get that out of the body, then it starts to reabsorb, and then they start to feel lousy. So usually, especially like when Dr. Emily's patients come over, usually she's already got them on some kind of detox routine so that we can do the magnets, and then it really minimizes any kind of die-off reaction. I mean, the goal is, I love it when people, when I talk to them in the next day or two and they say, oh my gosh, I feel so light, or I feel so much better, because we've not only killed something off, but we've gotten it right out of the body. It hasn't been just floating around in the body.
Right, right. And a little more background for people if they're not familiar with die-off. I mean, when we are especially addressing any like infection, virus, bacteria,
Mhm.
parasite, when you kill them off, they often release toxins that can be inflammatory and neurotoxic and just basically make your symptoms worse before they get better. Things like
Right.
headaches and fatigue and feeling achy and kind of feverish, like Amanda was saying. And even though some people use that as like, oh yes, I'm herxing or I'm having die-off, you know, we expect some of that to happen, but the real goal is to you know, allow for some of this killing off of the infection without overstressing the body,
Yes.
right? So, you
Yes.
know, what's helping to clear those toxins are the emunctories or the organs of elimination, things like the liver, the colon, the kidneys, the skin, the lungs. So we really want to make sure that those emunctories or organs of elimination are opened and ready to drain and detoxify so that those toxins don't, you know, all of a sudden create a
Right.
toxic load in the body or get reabsorbed. So
Right.
that's a really, really key piece for people that I work with. I mean, some people have tried stuff on their own or seen other doctors, and if they're not taking care of that inflammation and immune regulation, they have a lot of problems. So
Absolutely.
really important to make sure that you're addressing that well. And you know, it's great to work with practitioners that get that and have even
Right.
experienced that so they know what it feels like. Because it can be a little hard to navigate, right? Like, why am I feeling worse? You know, am I sensitive to the supplement or the medication I'm
Right.
taking, or is it the die-off? It can be hard to navigate.
It can. And
Yeah.
sometimes, people, they'll stop taking a supplement that's actually working because they feel a little bit lousy after. And it's like, no,
Yeah.
no, no, no. Like, let's explore this. Let's talk about
Right.
this. What
Right.
symptoms are you having? What's going on here?
Right.
And it's worth noting too with the magnets is I actually have um, a couple of different strengths of magnets. So if,
Hmm.
a lot of times patients will come to me and they know that they're going to be sensitive. Maybe they
Right.
know that they have a hard time detoxing, especially if they have the MTHFR,
Mm-hmm.
gene. And so, I'll tell them, let's do the magnets, but let's use the more gentle strength of magnets. So that way, maybe we're not going to blast the body as hard and kill off as much,
Right.
but we can just take a light layer off, and
Nice.
then maybe the next time they have a session, maybe we'll use like one pair that's the stronger magnets, but
Mm-hmm.
all the rest of them are the more gentle magnets. Like, I'm really good at
Yeah.
helping patients navigate that so that
Yeah.
they don't have to be fearful
Mm-hmm.
that it's going to cause a huge reaction.
Right.
The other thing that we always talk about when we're going to do magnets is just that aftercare. I always make sure that people understand, like, you might have the reaction, but you're going to want to drink water.
Mm-hmm.
Keep taking all of your other treatments. That's the beautiful thing. Reiki too. You continue to do all of your treatments that you're doing. These things are all complementary. They're not things that, oh, well, if you're going to do this, then you've got to stop doing this.
Right. Right.
So it's
Nice.
complementary.
And it's so important too to work with someone that gets that, you know, more and stronger isn't necessarily better, you know, because, you know, if you stress out the
Absolutely.
body too much, you can go backwards. So,
Right.
you know, being able to navigate, well, sometimes it is helpful to kind of slowly back off the dosing of something or use a weaker magnet or just like a
Right.
gentler magnet in the beginning and then allow your body to catch up and be able to stay on track, you know?
Right.
So that's
Because
awesome.
eventually your body will catch up. And I think
Absolutely.
sometimes people, I know that's how I felt. I had been sick for so long that
Yeah.
when people would tell me, oh, you'll feel better, I'd be like, yeah, sure. And
Mm-hmm.
then when I actually started combining naturopathic therapy with energy therapy, I really did start to feel better.
Awesome.
So it's amazing to put all the tools together
Right.
and trust in the process a little bit. And
Yeah,
sometimes it's hard when you've been sick for a long time to trust in the process.
absolutely. Yeah.
Yeah.
And then any tips or tricks that I know you said you teach some people how to do self Reiki, but any tips in general that people can do at home to help balance their energy or tune in to maybe chakras that are out of balance?
Sure.
Um, that'd be
Yeah.
fun to share.
Yeah, for sure. We actually do a monthly meditation and energy healing. And the reason why we do that, there's a few different things. There's a lot of people out there that they're intimidated by meditation because they
Mm-hmm.
say, well, I can't sit there and stay still for that long. Our meditation is guided. And typically what we do is we guide you through the chakra system of the body and
Mm-hmm.
just bring awareness to, usually when you think about it a little bit, and when we're telling you, like, if you're feeling this, when we're on a particular chakra, sometimes people don't realize, oh, that means that it's out of balance,
Right.
because they have felt that way for so long that that's normal for them.
Mm-hmm.
And then during our monthly meditation, we actually go through and we'll do a quick energy healing on that person. And we'll go through and we'll just, check out what's going on. And usually we remove stress off of people's shoulders. That's a big
Mm-hmm.
basic. People are like this all the time,
Mm-hmm.
and by the end we're, because we do it over Zoom right now, and we can see their shoulders slowly going down.
Mm-hmm.
So just something like that. Another thing that we do if people want to work with us and they need a little bit of an understanding is we do a free consult for people. And usually the consults are between like 15 minutes, half an hour. It's just, what's going on.
Right.
Because usually people want to, let us know a little bit of their story so that it can help us understand what they need. I think that sometimes it can be very hard to navigate this stuff all on your own. So,
Absolutely.
I suggest going to like our monthly meditation. I know that Emily does a monthly meditation as well. It's the first Monday of the month?
The last. It's
Last
been
Monday of the
slowing
month.
down a little bit virtually, and I've been getting busy with business stuff, but we'll definitely pick it back up soon.
Yeah.
I think technically the last, well, maybe not. I know we have Memorial Day coming up,
Right.
which I think is actually technically the last Monday of the month. So I'm not sure if we're going to do it this.
Everything's been different.
I know
the
everything
last few
shifted,
months.
right?
Yeah.
So, I mean, I highly recommend if you feel like you need some meditation to go to Amanda and Chris's.
Yeah.
Absolutely.
I think meditations help a lot, and there are guided meditations too on the web. But I think if you already know that you're an energy sensitive person and you're ready to jump in with trying some of these things on your own, I would say come to a level 1 class.
Yeah.
Right now we're doing all of our classes virtually. We did
Great.
one on Saturday, and the people that were in that, they couldn't believe it because, people think, oh, well, it's virtual, it's not going to be as good.
Right.
And it was almost more powerful, I think, because people were, they were in, a quiet room in their own house, so they could kind of let their guard down and do their thing. And we had some pretty spectacular experiences during our classes. But yeah, so,
nice.
Take a class, learn more about it. We have a YouTube channel where we post a lot of videos about different topics that, we've offered classes on, if people are interested in learning how to do like a crystal grid or,
Awesome.
Learning how to use crystals. Emily, you yourself, you do therapeutic gemstone energy healing, which I love. I've had that many times. So, just try different things out and see how they feel for you. But I think too, like, make sure that you're comfortable with your practitioner, because it's hard to kind of relax if you feel nervous about what's going to happen.
Absolutely. Yeah. Totally agree.
Yeah.
So how can people connect if they want to work with you one-on-one? Obviously, you talked about a lot of, virtual events and stuff. What's the best way to kind of keep hearing about what you're offering and working with you one-on-one?
We have a pretty active Instagram page, and all of our stuff is Dahl Holistic Health, DAHL Holistic Health. We have an Instagram page. We have a Facebook page for our business, but we also have a private Facebook group where we talk about some health topics, and I try to post different things over there for people that have a little bit deeper interest than just kind of knowing about the businessy things.
Right.
And we have, for our students, we have a private Facebook page for our Reiki students so that we can talk about in-depth Reiki topics. We really, we try to support everybody with where they're at. I have a YouTube channel, and I tell people you can contact me whatever way is easiest for you. So if that's email, my email is amanda@dahlholistichealth.com. My phone number is on my webpage.
Yeah, we can put in the comments, your email and website
Sure.
and stuff too. So if people want to connect with you, they can.
Yeah, I think we're pretty easy to find.
Yeah.
Or
Yeah.
our website, I guess, is the right,
Yeah.
dahlholistichealth.com.
Right. Right.
Yeah.
Yeah. I know everything for me is just wildcraft medicine.
Yes,
Yep.
same.
Awesome. Well,
Yeah.
thank you so much. I really appreciate your time. And
Thank
again,
you.
on a
It's
personal
great.
note, you've helped me so much, and I see you helping my patients all the time. So it's just highly recommend, especially during these times of high stress and so many transitions and just trying to figure out life right now. I know for me, energetically, it's been a little crazy, and the patients I talk to and just friends and family, like just things are a little bit unstable.
Right.
I think there's just so much up in the air, and we don't know when it's going to go back to normal. So even though that can be a little scary, like just, addressing each one day at a time and just trying to
Right.
stay focused and keep that, group of support system around you is really helpful. So,
For
I think
sure.
what you offer is so, so key right now to help people continue supporting their health.
Thank you. Yes,
Yeah.
I have good availability right now because I'm doing everything distance. So,
Yep.
I have 5 days a week I'm working with people.
Great.
So if you're feeling the effects of everything that's going on right now, have a session so we can remove those anxieties that you're carrying. Because a lot of times I think people are getting caught up in the energy of what other people are feeling, that,
Yes.
that collective consciousness that they talk about.
Yeah.
Don't get caught up in that piece of it. You're
Right.
you're still an individual that's making
Right.
a difference, and we can help make it so that you can still be productive and
Right.
be able to navigate through this without the levels of anxiety that some people are having out there. You
Yeah.
don't need to walk
Yeah.
around like that.
Right. Part of
Yeah.
it's just staying off Facebook and social media sometimes
A
and
little
taking
bit.
breaks
Yeah.
at least.
Breaks for sure. Yeah.
Yes. Yes. Awesome. Well, thanks again. We'll put your
Thank
information in
you.
the notes and hope everyone has a great day.
Yeah.
Let me check really quick if there's any questions. I know we had a comment from another naturopath. Um, Finding that, especially with patients that have SIBO, how great Reiki can really help shift things for them. And
Absolutely.
then, hi, Sarah, thanks for joining us. So I think she's asking, are you seeing clients in person yet? So,
No, in San Diego, phase 3 businesses, we do not have a date as to when we are going to go back into the office. And to just add to the fun, I am a high risk person. So I've been working with my doctor, and she said even after phase 3 goes back, she wants me to wait just a little bit longer to
yeah,
see what the case numbers are going to do. So,
yeah,
but I can work with anybody distance for this time. So we'll just sit tight and see what's going on,
yeah.
as the days go on here.
And hopefully when things get back to normal and Amanda's able to see people in person, hopefully we'll have her here at Wildcraft Medicine at least a day a week
Yes,
for some of our patients. So stay tuned for that, and we'll definitely make announcements once that's kind of up and running.
absolutely.
Yeah,
Yeah.
we're excited to have you.
Yes, we're very excited.
All right, everyone. Well, thanks again for joining, and have a great rest of your day.
Okay, thank you
All
all.
right, bye, Amanda.
Bye. Thank you.